Hello, my name is Anna Hosford, Clinic Director at Barbados Fertility Centre. I invite you today to follow with me the patient's journey from our side. The first step is to reach out to us. People find us on Facebook, they find us on Google, they find us from a doctor referrals, word of mouth, or online. They go on our website and fill out the contact form, or they go on our Facebook page and reach out to us through Facebook. The inquiry comes directly to the nurse coordinators. We look at each one and then we allocate them to the nurses depending on their specialities. The nurse takes time to read through their case and email them information that's applicable to them. Then the client is set up to speak with the doctor. Dr. Skinner, Dr. Corona, Dr. Davis. We have 3 wonderful doctors, and basically the patient gets a 45-minute free telephone consultation to review their medical history and their case. And our doctor gives them their recommended treatment plan based on their history and their case. Then the nurse coordinator takes the patient, gets them a financial quote through our financial department, and organises them for whatever treatment the doctor needs. And while that process is going on, the nurse is also organising with the client what dates they want to fly here for. So usually a patient needs to be here between 10 and 14 days, depending on where they live. Our Trinidad patients need to be here 7 days, Caribbean patients 10 days, and international patients usually 12 to 14 days. We can book your cycle between 2 months and 12 months in advance as far as dates are concerned, so that you can work towards those dates. And that's really important because it gives the patient a sense of control, an ability to kind of plan their life around their IVF. Before any patient comes into a cycle with us, we do what we call a pre-cycle meeting, and we go through their record. The doctor is there, the embryologist is there, the nurses are there, the financial people are there, the theatre nurse is there, and so everybody knows what's happening. That allows for a really good quality control that ultimately that results in excellent success rates. Once the travel is booked, the medications have started, the patient flies here. It's an exciting time, obviously. People usually fly in the day before, get some rest, get to de-stress, and the next morning they come into the clinic for ultrasound, a meeting with the doctor, any blood tests that are needed, etc. When they come to the door, they get the world famous Cereline hug. Cereline is our head receptionist and famous for her hugs and her ability to give you a warm welcome. You will get to meet the doctor and have your ultrasound. The very first ultrasound is to check for the follicular growth, in other words, that your ovaries are producing follicles in response to the fertility medications. After they have the scan, they meet their nurse, and the nurse goes through their medication, their next steps, tells them the do's and the don'ts on the island, and gives them advice as to where to go and what to do, and methods to de-stress. We've also got a life wellness centre, and a lot of our patients go there for massages and reflexology and acupuncture. Once they're ready for the trigger injection, which is the HCG, which is for the final maturation of the eggs, they will then go to the theatre section. Usually the patient comes in about 30 minutes before their procedure. They meet with the doctor, they get their pre-procedure checking done, and then they're brought into the procedure room. So the egg collection is done under sedation. Very light sedation, but the patient won't feel anything, but obviously instantly arousable if we need them to be. That day in the lab, the egg and the sperm are put together, either through IVF, which is where they wash and prepare the sperm and sperm is put with the egg, or the ICSI, which is where the sperm is washed and picked up and an individual sperm is injected into an individual egg. The next day is when we check for fertilization, and that's when the patient will get a call the next day from our embryologist with their fertilization results. When you come in for your embryo transfer, you will meet with the doctor. So the patient sits down with the doctor and they go through their embryo profile. They usually go through the whole cycle at that stage. This is how many follicles you had, this is how many eggs you got, this is how many fertilized, and the doctor goes through exactly what profile of embryos are being transferred on that day. After the doctors had the discussion, they sign the consent form as to that they agree to have 1 or 2 embryos put back, and then they get into their gown and go into the theatre. The patient is put in position and the nurse is assisting the doctor by doing the ultrasound. And once we have the speculum in position and we have a good view of the womb with the ultrasound, the doctor will call the embryologist and say, okay, we're ready for 2 embryos for Mrs. X. And that way the embryologist at that stage only takes the embryos out of the incubator, she loads them into the catheter and then passes the catheter through the hatch. On the scan, the patient's able to see the embryo transfer catheter going into the womb. They can follow it. You can't see the embryos because they're microscopic, but they're able to see a little flash of white, which is the fluid which the embryos are in, going into the womb. Once we get the all clear, the patient is ready to lie down for 10 or 15 minutes, and then either they can go back to their apartment, they can go upstairs for acupuncture, but the procedure at that stage is over. After the embryo transfer, they get escorted by Sarah Lean. She's their first point of contact when they come in with their hug, and she usually walks them out the door and wishes them safe travels. And again, it's a nice warm feeling that the patients leave with, and it's very important that they feel that they're part of the family, the BFC family. Then once the patient is home, they're going to do the pregnancy test. Usually their nurse coordinator is just as anxious to know as they are, so we do call them on the morning of their pregnancy test to find out the result. And that's a very exciting day in the clinic as well. If unfortunately the pregnancy test is negative, the patient does get a review with the doctor. That's a very important appointment so that they feel that they understand what might have gone wrong and where they go from there. And then when they get a positive outcome, we get to give them a letter for their doctor for some scans at 7 and 11 weeks. We get them to stay on their meds, and we give them positive pregnancy instructions, and that's wonderful. It's obviously what we're all aiming for. We do consider our patients part of our family, and it shows in people who bring their babies back to us. Even if they're not coming back for number 2, they come back on holidays with their baby because they were conceived here. So Barbados becomes a very fond family place for them, and they love coming to see us, and we love to see them too. But it's because they feel that we care, and we do.